with us today, no stranger to the show. We love having him on all the time. Cardiologist Dr. David Kavesteen from Heart and Health, who brought with him his friend and RN, Alyssa Lebrecq.
Yes.
And welcome to the show. We're glad to have you on.
Thank you.
There's so many things going on, Dave. As usual, medicine is changing every day. That's why we do these shows. One of the big things that's going on is what Heart and Health is doing with Medicare. You mind telling the audience a little bit about that?
Oh, of course. It's a pleasure to be here. It's always nice to come and talk about the different things and new advances and new discoveries, and it's great to be here. As far as advances goes in Heart and Health, as we spoke before many times, we emphasize on early detection and prevention of the diseases, especially heart disease. As you know, about 1 million people die from heart attack and heart disease a year. That's only in the United States. That's 1 out of 4 people dying from it. And heart disease can be prevented. If you detect it early and you can decrease the risk factors and treat it, it doesn't have to get to the point that you are in a heart failure or you have to go to the hospital in the middle of the night and be in the mercy of who's on call and ER being busy and overflown and who you're going to get. So our emphasis is usually based on prevention and early detection. And this year, with the help of Alyssa, we were able to start a new program called Medicare VIP program. As you know, we pay a lot of attention to our senior citizens and Medicare recipients. And there's a lot that Medicare wants to do to help senior citizen and elderly populations healthy, because we realize if we can keep them healthy and prevent the disease, it's going to be cheaper and is also going to be better for the patients. So Medicare has been having programs that detects and helps pay for different diagnostic testing to diagnose aortic aneurysm, cancer, and multiple different things. And many people don't know about this. And it doesn't apply towards a deductible. It doesn't apply towards copay. It's all fully paid for. It's something that Medicare wants for patients to take advantage of it. And with help of Alyssa, we were able to start the Medicare VIP program starting this year, which I'm very proud of. I'm going to let Alyssa to talk more about it because she's basically directing and helping to start this program and spearheading it.
Alyssa, I just want to go over, for people on the audience who don't know you, they're very familiar with Dr. Kavesteen and his
Sure.
credentials. Can you tell us a little bit about yourself and your credentials?
Sure. So I graduated with a 4-year degree from Oneonta, and then I went on to nursing school. I'm a registered nurse. And I was hired by Dr. Kavesteen in August to do this Medicare program. So I was hired with the intent of reaching out to the Medicare population specifically to sort of, like he said, prevent heart disease, prevent any chronic conditions such as diabetes and hypertension from affecting our population. It's an epidemic for sure. So we bring in patients and we do screenings for them. We make sure that all of their health information is up to date and that they're getting medications that they need to control any chronic conditions they may have. And it's, like he said, free of cost for all of the medications. And if they have any questions or concerns, they can reach out to me. I'm always available at Heart and Health, all 3 locations. So it's been really good.
Yeah, and I noticed a couple of times when I went down there, I saw you sitting down with these people, and you had like a questionnaire, and there was a bunch of things that you were going over with them. And the whole thing with Heart and Health and with you and Dr. Kavesteen is an ounce of prevention is worth a pound of cure.
Absolutely.
Because if we can catch the hardening of the arteries before it has a heart attack, your risk is greater to save the life, right? Your odds are a lot better to save the life than your risk are when they're in the emergency room, like you said before, at 3, 4 o'clock in the morning. Now, the thing is, heart attacks don't discriminate, okay? Anybody can get them at any time. It is rare, for people under 25, stuff like that. But the target audience with Medicare is the 60 plus, 55 plus, 65 plus. What is it?
I would say 55 and up is our predominant audience. We do have younger patients who come in who are younger, who are covered by Medicare. So luckily, if they are having a cardiac problem, they're already coming to see Dr. Kavesteen, which is how I'm usually
Right.
introduced to them. So they're getting help from me and also from Dr. Kavesteen to prevent any cardiac issues from getting worse.
Now, your arsenal of tools, we had spoke about this before, because technology is constantly changing in medicine. I don't think people can even keep up with. Most doctors can't even keep up with what's going on. What are some of the tools that you use for help for diagnostic and stuff?
To look at heart disease per se, we look at the heart with ultrasound, and we look at the valves to make sure that there are 4 valves in the heart, to make sure the valves are structurally intact, they're able to function appropriately, they're not stenotic, they're not tight, they're not leaking, they don't have regurgitations. And also the walls of the heart, to make sure the left ventricle is pumping well and is able to carry and push the blood through the rest of the body to bring the oxygen and nutrition. As you know, your heart beats in average of 80 beats per minute, and if you multiply it, that becomes billion times a year. And as a result, these valves open and closes, and there's friction with these valves, and as a result, there's a wear and tear. Fortunately, our body has a tendency of healing of these frictions and these wear and tear, but there's always a balance, how much of a wear and tear it gets and how much your body is able to repair it constantly. Now, if you have a high blood pressure, you have diabetes or other risk factors, these valves, they get damaged and they become very tight and stenotic. They call it valvular stenosis or valvular heart disease. The other things that we look for, or we do the stress test. We're making sure that if the patient is able to exercise, the heart, his heart is able to increase in rate and increase in pump blood through the circulation system, and if there's any blockages in these arteries, which are very small arteries, we can detect it, and we can actually intervene either by aggressive medical treatment or by interventional putting in stents. We can increase those blood flow and make the heart to rejuvenate and get stronger and better, and preventing it from closing, which when it closes becomes a heart attack. So preventing it eventually.
Now, the valves are just one part. You hear a lot of the term arterial sclerosis.
Correct.
If I'm saying it correctly. That seems to happen. And there's also a condition they call congestive heart failure.
Correct.
Now, what's the difference between that and the valves and some of the other?
Congestive heart failure is when the heart is not able to pump enough for the body metabolism. As a result, the fluids and the blood accumulates in the lungs, and there's a shortness of breath. So with the small limited activities, the shortness of breath happens. That's when the heart is not able to pump. Now, the reason why it's not able to pump could be due to multiple different reasons, right? One, it could be because of atherosclerosis disease is blocking the arteries. When the arteries start clogging up with cholesterols and platelets and other stuff. And the second one is if someone is using alcohol or drug, the heart start getting weak because these alcohol and illicit drugs can potentially damage the heart and cause cardiomyopathy. And the third one is valvular heart disease, when the valves are too tight and the heart is not able to pump. Even though the heart is strong, the valves are not opening. Think of valves in the heart like a door that opens and closes. As these doors open and closes multiple times, either it start leaking, or it just the hinges start not working well, or becomes calcified, or start making a squeezy noise and other stuff. And as a result, the heart is not able to push the blood through these tight openings, and after a while, it becomes dilated and becomes very weak. Now, congestive heart failure, it basically goes with saying the heart is not pumping well. Okay, but however, the most important thing is to find out why the heart is not pumping well. Is it mechanical? Is it due to the arrhythmia, electrical component? Is it due to drugs? Is it due to heavy metal toxicity? or even Lyme disease sometimes can cause myocarditis and cause the heart to not function well. This is something that we see a lot in Long Island, just because we see a lot of Lyme disease cases. So finding the underlying cause of congestive heart failure is the most important things. However, in a lot of doctors, a lot of cardiologists, they just treat the disease by medication, like putting a bandage on it, by just treating congestive heart failure, giving diuretic and other stuff, and not looking to find out what's the underlying causes. As a result, the person is not getting better. He just simply has to take medication for the rest of his life. So our philosophy is always early detection and prevention, and finding the etiology, or what's causing the symptoms, rather than treating the symptom itself.
Now, you and Alyssa basically have to be detectives when a new patient comes in. That's why you use the diagnostics, the tests and stuff like that, because you have to, figure it out. I know a couple of past studies that were done with people with COPD and how that puts the strain on the heart. And if your heart is not getting enough oxygen, is also another problem that they run into it. I know there's the nutrient, but there's also an oxygen factor, right?
Yeah. So it's important to understand that the heart itself, as an organ in the body, needs blood and nutrition to be able to pump and work, because every beat and every contraction needs glucose, needs oxygen, and needs minerals. And these are brought in through the small very arteries called coronary arteries, which are very small in diameter. They're usually about 2 millimeters in diameters. And they are on outside of the heart, okay? And they are on the left side. It's called left main, which branches to left anterior descending and left circumflex, and the right side, which is right coronary artery. Think about it as a branches of a tree. Now, if you cut any of the circulations through of any of these small arteries, the rest of the heart that these blood supplies brings minerals and oxygen, they basically don't get it anymore because it's completely occluded. As a result, that part of the heart dies because it doesn't get the nutrition, and it becomes very weak and it doesn't pump anymore. And that's the typical, what we call acute coronary syndrome or heart attack that happens. Now, people should realize that the heart doesn't die instantly as soon as these arteries closes. We usually have about up to 6 hours to open this artery and reinstate the flow of oxygens and minerals, and the heart, the muscle itself, doesn't die. And so that's what's very important, that people at home realize the signs and symptoms of heart attack. So when that symptoms happen, there is 6-hour rule, meaning
Right.
like from the time of the symptoms, if you get it on time and you go to the hospital and you get to the cardiac catheterization, they can open that artery, and the heart is not going to lose its functionality, and there won't be any significant damage. However, if the time passes by and they don't detect it, or the patient doesn't go to the hospital, then after six hours, that muscle, that part of the heart is completely gone, or what we call necrotic, and it doesn't function anymore, and there's no way to bring it back.
Now, also, on the last program, we had spoke about stroke
Yes.
and the progress that's made in that, because if somebody is having a stroke, there's certain signals and stuff like that. They know they need to get into the emergency room. The timing of the factor of a stroke and a heart attack, is that basically about the same?
It's not exactly the same, but brain, like heart, same. If there is a decrease in blood flow, because there is a blood clot occluding the artery in the brain, and that's a stroke, you have about 3 hours to open that artery and try to get the flow back. And if you do that, then the stroke and the sequela of a stroke becomes very, very minimal. However, if you don't detect it on time, then it's too late. Heart muscles per se, they are much more they have more vasculatures going to it. As a result, the timing is longer than brain. The brain is much more sensitive and is very specific. So the stroke is a very devastating disease, as everybody knows it, but it also can be reversed if the time they get the right treatment right away within 3 hours, and they open that artery.
Yeah.
Now, one of the things we do in Heart and Health recently, we were able with new advances in medicine, we actually have a new program which is called transcranial Doppler program. This with this diagnostic test, we actually can see a blood flow to the brain, and we can detect if there is any emboli or any blockage in the brain. Before, if you wanted to look at the brain, you had to either get a CAT scan, which has a lot of radiation, or MRI. But now with this transcranial Doppler,
Right.
we can see the blood flow in a real time with ultrasound that doesn't have any radiation. Therefore, if there is any evidence of a stroke, we can be very proactive, and we can prevent it.
And you've said in the past you have never been a pro-radioactive person, let's say. You're not too hip on using the radioactive materials when there's other materials around. And this Doppler thing it's really fantastic. I've seen the pictures of what they come up with, and it's really something else. And it is like the Doppler radar that they use for the weather.
Correct. And these are just because the technology is advancing, and we're taking advantage of it in heart and health. And we always try to do, we always say, do no harm. That's the first thing.
Right.
And in my personal opinion is all the radiations that we get, either through the electric currents, throughout these, the wiring, or through X-rays or CAT
Right.
scan, or even nuclear stress tests, they are all cumulative radiation. And I think that's one of the cause of why we're having such an increased rate of cancer in Long Island.
Yeah, because they get exposed to that, and it takes your body a certain amount of time. And I think, Alyssa, you know this too, with PET scan, CAT scan. You're really being subjected to 100 X-rays or something like that. It's equal to 100 X-rays. And how does your body get rid of that radiation? I mean, it's got to take a long time, right?
It's cumulative. It's all about how much you're going to be exposed throughout the year. And how you protect yourself. Now, if you take it within a certain amount, I mean, we get radiation from sun ray, right? And we get radiation from microwave, from your cell phone, from everything. It all accumulates. And the more radiation you get, the more damage that happens to the DNA of the cells. And there's more mutations, and the more mutation can cause more cancerous cells. And more cancerous cells eventually can become and expand and become a tumor and expand. So, do no harm, help the patients, educate them. Those are our basic concepts in heart and health. Last week, Alyssa was able actually to save a woman of she was 78 years old that came in, and throughout just usual questioning and asking, we actually able to discover that she had an aneurysm in her abdomen, which was very big, about to rupture. Aneurysm is basically ballooning of the arteries and what it happens, it just balloons up and balloons up. Usually the way I explain it to my patient is, think about the water hose you have in your backyard, right? If
You get a bubble.
it gets bubbled, right?
Yeah.
So the arteries in your body also, it gets weakened, and if the blood pressure is not controlled, it also bubbles and makes the aneurysm. Now, it gets to the point that aneurysm, that bubble, it balloons up so much that it ruptures. Unfortunately, if it ruptures and you're not in the right place, it's called rupture of aneurysm. It's catastrophic because there's no way you can patch it. It's not easy, and you bleed
out,
inside.
right?
You just bleed inside your body, and you die suddenly. So I'm proud of her that to be able to save a life, by just simple doing abdominal ultrasound, which Medicare actually covers. And that's part of the Medicare VIP program that we do in heart and health. And Medicare wants you to be able to be screened to see if you have these diseases, so you can easily save your life, and be preventive, rather than not to use the medical services or take care of yourself and you become sick or stay sick.
The way a patient looks when they first come in, you first see them, doctors and nurses can usually tell what's wrong.
Sure. I mean, there are always telltale signs of certain things. A heart attack, I'm having chest pain, I'm having nausea, I'm having shortness of breath, things like that. But there are also times where patients might be feeling symptoms and they don't realize what it actually is. So it is important to pay attention to how they're acting, how they normally act versus how they're feeling now, and to get a baseline for them. And that's why we keep everything updated in their health record to catch those changes as quickly as possible. And we do screenings such as the aneurysm screenings and different Doppler tests that we do and echoes that we can do on their heart and EKGs, just to get a baseline for them to see if any changes occur, we can get them to a hospital or get them treatment right away.
There's this fear that everybody has when they're going to see a cardiologist, like, oh my God, what is he going to tell me if I'm going to die, I'm going to be dead. They don't realize that, again, like we were saying, prevention, getting in there early. If you did have a problem, we can nip it in the bud now before it's 4 o'clock in the morning at the emergency room and you're having a heart attack.
And even before something happens, to come
Right.
in, even if you're healthy, if you're getting to a certain age and you're noticing any health changes, it's important to keep up with primary doctors, your cardiologists, your specialized doctors, to make sure that you prevent anything, not just wait till you're really sick. And that's what Medicare is trying to help with this program, to get early detection and prevention before they come in and something's really wrong.
Yeah, because everybody, and Dave, you know this because you see that these new patients, and I've seen them when they're down there, and it just this look on like, they're going to be operated on, and they really don't know.
So people don't go to the doctor's office to party. It's not a happy occasion. It's usually something that it's triggered the person to seek medical attention. And a lot of times people associate going to the doctor's office with the past experiences, such as, when you were a kid, your mom took you to the pediatrician office and you got a shot. So you automatically relate yourself, and you sort of put the experience of going to the doctor's office as getting a bad news or getting injections or pain or other things. As a result, people stay away, and they usually come when they really need to be. However, education is a big part of medicine, and I think any good doctor should explain to his patients in lame terms what the disease is, what the diagnoses are, and make sure the patient understands. It doesn't matter where the patient comes from or what background they have. The doctor's communication skills or nurse's communication skills is very, very important to provide that medical care and
Right.
medical treatment. Putting the patients at ease, after I meet the patient for the first time, the second time, they feel much more comfortable and they're looking forward to come because now they know what's going on. They want to help themselves. They know the reason what's going on. And I always tell my patient when I meet them for the first time, I said, listen, I promise you that I'm going to be truthful, and I promise you I will tell you and explain it to you for you to understand, and then we come up with a working plan. And I be with you throughout the process of the treatment. Doesn't matter what you do or what you decide to do, you're ultimately the boss. So the patient ultimately is the person who makes that determination about his or her medical
Right.
care. And I think a good doctor will support that decision, not to dismiss it or not to go against it or not to force a patient to do something. I think if you explain the disease correctly and you explain with the right terminology that the patient understands, patient should make the right decision, right informed decision. And because of all these things that we've been doing in Heart and Health, Medicare has chose us to be the first center in Long Island to be in double-blinded study for heart disease called Million Heart Disease Model. The thought behind it is by looking at what we do at Heart and Health and some other facilities throughout the country, they can find out how can we reduce the heart disease and how can we be more successful. So we were recently just chosen to be one of those double-blinded centers in Long Island, which very few of them were chosen, and we're proud of it. And it all comes into the fact that Medicare sees that our patients are being treated better, and we pay a lot of emphasis on preventions and early detection, and that's something that Alyssa has been helping me out, and to do the first ever study by Medicare. So
For people who may be watching the show, Alyssa, who qualifies for this program at Heart and Health?
Sure. The Million Heart program is, and the Medicare VIP program is anyone who's covered under Medicare. So we're very lucky that we get to cover hundreds and hundreds of patients as long as they have Medicare. And Million Heart model is looking specifically at patients who have risks for heart disease, such as hypertension. They look at their blood pressure, what medications they're on, and certain comorbidities that might put them more at risk for heart disease. And then we put in all of these numbers, and they make a risk score calculation. So there's specific numbers that if patients hit a certain level or not, they might be closely looked at and monitored throughout the year, that they
Right.
can make appointments with Dr. Kavesteen, and that we're paying close attention to their heart because they could be at risk for a heart attack or heart disease.
Yeah, so this is really a big part of the screening process
Yes.
before they're even, hooked up to a machine or electronics or anything like that. So, we're running out of time here, but with this program, so anyone who's on Medicare, they could
Yes.
just call you guys up, make an
Yeah.
appointment, and they come in.
It's a completely
it's
free
covered.
program.
Yes.
It's there is you don't even have to be a patient in Heart and Health. I mean, you can just come and take advantage of the program and still see your own doctor. It doesn't apply towards any copay, any deductible. It's completely covered, and it's all about looking and screening for not only heart disease. It does the mammogram, the pap smear, fall precaution. I mean, a lot of elderlies that hip fractures is usually and make them end up in the hospital, and later on they deteriorate. So by detecting a person is in the fall risk, we can do other stuff. Or depression. A lot of the senior citizens, they're depressed and no one really looks at them. No one asked the right question, and Alyssa came in with a very nice questionnaire to the depression screening, suicide or suicidal thought or ideations. So all those things, what we look at Heart and Health is not only heart per se, is the whole human body, the mind and all the organs and everything else together. But we know one thing is the heart is the most important one. So that's what we call it, Heart and Health Medical.
Well, Dr. Kavesteen, I want to thank you for coming on the program, and Alyssa, you also. And we look forward to having you back again
My pleasure.
and answering some of the questions and letting us know how this program is going now that it's been moving forward, and how things are going to be going with the state and the data that you collect, and with some of the patients.
Yeah, obviously anyone can go on to our website, www.heartandhealth.com, or they can contact us through the website. They can make an appointment on the website. They can leave comments on the website, or they can send questions to you through the website. And we'd be more than happy to come back and answer any questions and help the residents of Long Island to live a happy and healthy years.
Well, Dave, thank you for coming on, and we
My
look
pleasure.
forward to seeing you soon.
My pleasure.
Until next time, I'm Larry Mike Arenda. This has been Excelsior Forum, and we'll see you right back on this channel. Take care.